Beta-human chorionic gonadotropin. What is the name of the substance used to determine the presence of pregnancy? Beta-human chorionic gonadotropin. The amount is used to determine if it is normal pregnancy or molar pregnancy or multiple pregnancy. What is the name of the germinal layers? Ectoderm, mesoderm, and endoderm. Why is potassium more concentrated outside the cell? It is not. Sodium is more concentrated outside of cells. Megaloblasts are the origin of what? Red blood cells. Megaloblasts are immature erythrocytes. What is the name of the macrophages when they are circulation? Monocytes. What is the alternative name of platelets? Thrombocytes. Blood type O has what antigens? They have no antigens. If someone has hematocrit of 37 and marked leukoblastosis, what is the name of the condition? Leukemia. Why are leukemic persons anemic? Because of the compression of other erythropoietic lines. Blood type B has agglutinogen A? False. It has agglutinin A and agglutinogen B. Erythroblastosis fetalis is what type of condition? Rhesus dependent. What is the meaning of someone having a hematocrit of 25? It means that for every 100 milliliters of blood, only 25 milliliters is formed elements. Erythropoiesis is a synonym of hematopoiesis? False. Erythropoiesis is production of red blood cells and hematopoiesis is the formation of blood in general. What is the main stimulation factor for erythrocyte production? Erythropoietin. When immature, thrombocytes are nucleated. False. Thrombocytes are never immature, they are fragments of megakaryocytes. What is the name of the subtidal volume and physiological dead space? Nothing. That does not exist. The vital capacity is the ability to survive with poor oxygen availability? False. What is the vital capacity? It is the sum of all the lung volumes except residual volume. Dead space is found in corpses? True, it is always there. Names of accessory respiratory muscles? Sternocleidomastoid, scalene muscles, pectoralis. Alveolar ventilation is amount of air inhaled in every ventilation cycle? False. It is the amount of air that actually reaches the alveoli. Definition of the partial pressure of a gas? How much carbon dioxide produced is transported as a compound in our blood? 70%. What is the name of the combination of carbon dioxide with hemoglobin? Carbaminohemoglobin. What is the name of the combination of carbon monoxide with hemoglobin? Carboxyhemoglobin. Carbonic hydrolase separates carbonic acid into carbon dioxide and water. False. It is carbonic anhydrase. Where can you find the agnostic center? No such thing as agnostic center. Define tidal volume. Amount of air exhaled after normal inspiration. Define expiratory reserve volume. Largest volume of additional air that can be forcibly exhaled. Define inspiratory reserve volume. Amount of air that can be forcibly inhaled after normal inspiration. Define residual volume. Amount of air that cannot be forcibly exhaled. How to calculate vital capacity. The sum of inspiratory reserve volume plus tidal volume plus expiratory reserve volume. Define minimal volume. The amount of air remaining after residual volume. Define inspiratory capacity. Maximal amount of air that can be inspired after normal expiration. What are the necessary steps for eliminating a drug? Drug half-life, accumulation, clearance, onset, peak, and duration. How is drug potency and efficacy is determined? Based on experimental drug dose. What is the therapeutic index? Range from minimum dose effect to toxic effect. What are some special considerations for drug prescriptions? Pregnancy and age. What are some examples of drugs coming from plants? Morphine, atropine, digoxin. What are some examples of drugs coming from animals? Insulin, oxytocin. What are some examples of drugs coming from synthetics? Sodium bicarbonate, calcium chloride, magnesium sulfate. What are some examples of drugs coming from elements? Lidocaine, diazepam, human insulin. What type of agonist is epinephrine? Adrenergic receptor agonist. What kind of chemical substance are dopamine, adrenaline, and norepinephrine? Natural catecholamines. The effects of acetylcholine are much more profound on beta receptors. False. Muscarinic receptors. What kind of reaction is asthma? Allergic reaction. What is the treatment for asthma? Epinephrine asterisk, salbutamol asterisk, inhaled corticosteroids, antibiotics for prevention. How would you define pharmacology? Study of drugs and its interaction with the human body. Epinephrine increases electrical and peripherally vascular resistance? True. Factors important for absorption, sex and strength of patient? No. Factors important for absorption, stature of the patient? No. Factors important for absorption, blood supply? Yes. Factors important for absorption, solubility and concentration? Yes. What natural structures under normal circumstances affect distribution of drugs? Hematoencephalic and placental barriers. What is the eye problem eventually produced by oxygen? Retrolental fibroplasia. What do you have to do with oxygen when administering more than 6 liters? Humidify the oxygen. What is the problem of administering oxygen in patients with COPD? Hypoxic drive. What is the effect of parasympathetic stimulation on pupils? Meiosis. What is the effect of sympathetic stimulation on pupils? Mydriasis, dilated pupils. What is the name of the skin and its components as a system? Integumentary. In what way does sympathetic and parasympathetic affect integumentary system in the same way? Perspiration. What is the meaning of QID? Quater in die. What is the meaning of the order stat? Immediately. What is the meaning of potentiation? Another drug is used to push/amplify another drug's effect. What kind of application is vaginal? Parenteral. What kind of application is nasal? Parenteral. What kind of application is nasogastric tube? Parenteral. Enteral application apples to what root? Anything given via the gastrointestinal tract. How many mcg are in 1 gram? 1 million. How do you define synergism? Two drugs that work together to create a greater effect. What are the 6 rights of administering a drug? Patient, drug, dose, route, time, documentation. If a patient is severely nauseous and hypotensive, what route would you use? Intraosseous. Can naloxone be considered a poison? Yes, it can be, dose-dependent. If you find an unconscious patient with diaphoresis, bradycardia, and have a gunpowder smell, what are you suspecting? Organophosphate poisoning. Substances that mediate anaphylaxis? Prostaglandins, histamines, kinins, leukotrienes. What is a toxidrome for anticholinergic? Med as a hatter, blind as a bat, red as a beet, hot as a hare. If you give nitroglycerin to a patient, what happens to the preload of the heart? It decreases. If you give nitroglycerin to a patient, what happens to the afterload of the heart? It decreases. What is the average dose of glucagon? 0.75 milliliters. What is the onset of sublingual nitroglycerin? 1 to 3 minutes. Consider a patient in hyperexcited state. What could have caused it? Sympathomimetic overdose. Yes. Consider a patient in hyperexcited state. What could have caused it? Amphetamine. Yes. Consider a patient in hyperexcited state. What could have caused it? Drug withdrawal. Yes. Consider a patient in hyperexcited state. What could have caused it? Anticholinergic overdose. Yes. A hyperexcited state corresponds to what toxidrome? Med as a hatter. Is stroke volume influenced by afterload? No. What is the duration of the effects of glucagon? 60 to 90 minutes. Do you think hypertensive and headache and symptoms of nitroglycerin? No, not hypertension but hypotension. What kind of drug is lansoprazole? Calcium channel blocker. What kind of drug is Solocortef? Synthetic steroid. What kind of drug is aminophylline? Bronchodilator. Epinephrine produces positive inotropic effects, therefore increases contraction force? False. Inotropic is contraction force. Does epinephrine decreases glucose level in blood? Epinephrine will cause body to use more energy and increases glycolysis. True. False. What is myoclonus and under which pharmacological condition do you see them abundantly? refers to sudden muscle contractions, organophosphate poisoning conditions. What is the term for when you can move your eyes rapidly back and forth? Nystagmus. What is the psychoactive component for marijuana? Delta-9 tetracannabinol. LSD is an amphetamine. Hallucinogen. From digestive POV, what is the main difference between marijuana and amphetamine? Marijuana increases appetite while amphetamine decreases appetite. What kind of drug is alprazolam? Benzodiazepam. What is the special action of alprazolam even though it's a benzodiazepam? Anxiolytic, used to reduce anxiety. Do anticholinergics produce diaphoresis? False, dry as a bone. Cholinergics produce diaphoresis. Diazepam produces muscle relaxation the same as Valium? Diazepam is Valium. Cyanide antidote kit has formaldehyde nitrate? False, it does not. If someone drinks half a liter of sulfuric acid, you should perform gastric lavage? Do not perform gastric lavage or give neutralizing agents, only way is to accelerate digestion speed to try to pass it faster. Metals which most likely produces acute poisoning, lead? No. Metals which most likely produces acute poisoning, aluminum? No. Metals which most likely produces acute poisoning, iron? Yes, antidote equal deferoxamine. Metals which most likely produces acute poisoning, silver? No. Metals which most likely produces acute poisoning, nickel? No. What element is most likely to produce acute poisoning? Phosphorus. What is the most notorious effect if someone overdoses with Valium? Respiratory arrest. Most commonly used fibrinolytics? Streptokinase, tissue plasminogen activator, alteplase, anisplase. What kind of drug is heparin? Anticoagulant. Morphine is a narcotic? Yes, and an analgesic. What is the meaning of being narcotic? Inductor of sleep. Methylprednisolone is used in spinal cord trauma? Yes. What is the main similarity between dexamethasone and hydrocortisone? Both are steroids. What is mannitol? Osmotic diuretic. What are the two words for sleep? Narcos and hypnos. Cardiac arrest, anaphylaxis and severe reactive airway disease are indications for dexamethasone? No, not cardiac arrest. Cardiac arrest, anaphylaxis and severe reactive airway disease are indications for mannitol? No. Cardiac arrest, anaphylaxis and severe reactive airway disease are indications for acetylcholine? No. Cardiac arrest, anaphylaxis and severe reactive airway disease are indications for epinephrine? Yes. Why is dopamine a parasympathetic agonist? It's not, it's a sympathetic agonist. What kind of drug is phenytoin? Anticonvulsant, antidysrhythmic. Phenytoin is used to manage postdigitalis arrhythmias? It's not used to arrhythmias. What do you use to treat postictal epilepsy? No answer. Do not treat. Valium is a mood enhancer? False, it is not. What is the immediate goal of assisted ventilation? Maintaining life. Also trying to maintain O2 levels between 92 to 96%. Oxygen therapy is maintaining what? Normal oxygen levels between 95 to 100%. Why is propranolol used to reduce blood pressure? Because it's a beta blocker. Why is propranolol used as an antiarrhythmic? Blocks the action of epinephrine and norepinephrine on the heart, reduces oxygen demand and perfusion of oxygen of muscles. What kind of rhythms are beta blockers contraindicated? Bradyarrhythmias. What kind of drug is albuterol? Beta agonist. What kind of drug is atropine? Anticholinergic. Why is acetylcholine indicated for COPD? It's not, it's contraindicated. What are the indications for racemic epinephrine? Croup. Hydrocortisone is a natural hormone from adrenal cortex? False, it's not natural. Ketoacidosis occurs when cells are glucose poisoned? False, when cells are glucose depleted. What is the antidote for benzodiazepam overdose? Flumazenil. What is a hypothesis? An idea or principle to be tested in experiments. What is an experiment? Series of tests of a hypothesis. A controlled experiment eliminates biases or outside influences. What is a theory? A hypothesis that has been proved by experiments to have a high degree of confidence. What is a law? A theory that has an unusually high level of confidence. Definition of anatomy. Science of the structure of an organism and the relationship of its parts. Definition of gross anatomy. Study of the body and its parts relying only on the naked eye as a tool for observation. Definition of microscopic anatomy. Study of body parts with a microscope. Definition of physiology. Science of the functions of organisms. Subdivisions named according to organisms involved, organizational level and systemic function. What is autopoiesis? Living organisms are self-organized and self-maintaining. What is cell theory? If it is made of one or more cells, it is alive. Levels of organization. Cells are the smallest and most numerous units that possess and exhibit characteristics of life. Levels of organization. Tissues are an organization of similar cells specialized to perform a certain function. Major types: epithelial, connective, muscle, nervous. Level of organization. Organs are organization of several different kinds of tissues to perform a special function. Each has a unique size, shape, appearance, structure, and placement in the body. Levels of organization. Systems are the most complex organizational units of the body, involved varying numbers and kinds of organs arranged to perform complex functions. What is anatomical position? Body erect with arms at sides, palms forward, head and feet pointing forward. What is bilateral symmetry? A term meaning that right and left sides of the body are mirror images. Body cavities. Thoracic cavity consists of right and left pleural cavities, mediastinum. Body cavities. Abdominopelvic cavity consists of abdominal cavity, pelvic cavity. Body cavities. Dorsal body cavity consists of cranial cavity, spinal cavity. Body regions. Axial subdivision consists of head, neck, torso, trunk and subdivisions. Body regions. Appendicular subdivision consists of upper extremity and subdivisions, lower extremity and subdivisions. Body regions. Abdominopelvic regions consists of right hypochondriac region, epigastric region, left hypochondriac region, right lumbar region, umbilical region, left lumbar region, right iliac region, hypogastric region, left iliac region. What is effector mechanism? Effectors directly influence controlled physiological variables. What is feedback? Process of information about a variable constantly flowing back from the sensor to the integrator. What organs are in the right hypochondriac region? Liver, gallbladder, right kidney, hepatic angle of the colon, transverse colon. What organs are in the left hypochondriac region? Spleen, splenic angle of the colon, left kidney, tip of the pancreas, fundus portion of the stomach, transverse colon. What organs are in the epigastric region? Liver, pancreas, duodenum, smaller portion of the stomach, transverse colon. What organs are in the right lumbar region? Gallbladder, liver, ascending colon, pancreas. What organs are in the left lumbar region? Descending colon, left kidney. What organs are in the umbilical region? Umbilicus, jejunum, ileum, duodenum. What organs are in the right iliac region? Appendix, cecum, ascending colon, right ovary. What organs are in the left iliac region? Descending colon, sigmoid colon, left ovary. What organs are in the hypogastric region? Urinary bladder, prostate, female reproductive organs. What organs are in the right upper quadrant of the abdomen? Liver, gallbladder, duodenum, pancreas, hepatic angle of colon, right kidney, right adrenal gland, ascending colon, transverse colon. What organs are in the left upper quadrant of the abdomen? Stomach, spleen, tip of the pancreas, left kidney, left adrenal gland, descending colon, splenic angle of the colon, transverse colon. What organs are in the right lower quadrant of the abdomen? Appendix, ascending colon, right ovary, right fallopian tube, right uterus. What organs are in the left lower quadrant of the abdomen? Bottom portion of colon, sigmoid colon, left ovary, left fallopian tube, left uterine tube. What is the cephalic area? The head. What is the cranial area? The upper skull. What is the facial area? The face. What is the frontal area? The forehead. What is the orbital area? The eye socket. What is the nasal area? The nose. What is the zygomatic area? The upper cheek. What is the buccal area? The lower cheek. What is the oral area? The mouth. What is the supraclavicular area? The area above the clavicle. What is the axillary area? The armpit. What is the mammary/pectoral area? The breasts or pectorals. What is the brachial area? The upper arm. What is the cubital area? The elbow. What is the antecubital area? The area in front of the elbow. What is the umbilical area? The belly button. What is the antebrachial area? The forearm. What is the carpal area? The wrist. What is the digital/phalangeal area? The fingers. What is the thoracic area? The whole chest. What is the abdominal area? The whole abdomen. What is the pelvic area? The whole pelvis. What makes up the trunk? Thoracic, abdominal, pelvic regions. What is the palmar/volar area? The palm of the hand. What is the femoral area? The thigh. What is the inguinal area? The groin. What is the crural area? The lower leg. What is the tarsal area? The ankle. What is the digital area? The toes. What is the pedal area? The foot. What is the temporal area? The side of the head. What is the cervical area? The back of the neck. What is the dorsal area? The back. What is the olecranal area? The back of the elbow. What is the flank area? The lateral region. What is the lumbar area? The lower back. What is the gluteal area? The glutes. What is the popliteal area? The back of the knee. What is the plantar area? The sole of the foot. How many skeletal muscles reside in the body? 600. Different connective tissue components. 1. Endomysium. 2. Paramysium. 3. Epimysium. Endomysium is delicate connective tissue membrane that covers skeletal muscle fibers. Paramysium is tough connective tissue binding together nerves or muscle fibers. Epimysium. Coarse sheath covering the muscle as a whole. What do epimysium, paramysium, and endomysium continue to fuse into? These three fibrous components continue and fuse to become a tendon or aponeurosis. Attachment of muscles. Origin means point of attachment that does not move when the muscle contracts. Attachment of muscles. Insertion means point of attachment that moves when the muscle contracts. Muscles actions. Prime mover means a muscle that directly performs a specific movement.